closings, individual schools closings. I, as the governor of Maryland, am not going to make decisions about which event to close, which school to close, what individual jurisdictions should do. We're going to give them the best advice and guidelines we can, whatever the federal government is passing on, whatever our experts think, and then other individuals we're going to empower them to make their own decisions.
Thank you.
Yeah, thank you.
decision and to consider live streaming and recording of events, if appropriate, to prevent community spread from starting in our county. My role in this work is to understand as well as possible the capabilities and the challenges of all of our county departments, so that when we have to make decisions, difficult decisions, they're based on fact, they're based on what we know from the professionals in all of our departments that are making government work. And in times like these, government is absolutely essential, and so continuing all government programs and operations as much as possible is absolutely essential. I want to thank everybody, all the public servants in Anne Arundel County for the work they do, their leadership as well. I have been really impressed by the readiness and the hard work that people put into this. And my message to both our staff and to the general public in Anne Arundel County is that we should remember that the work that we do and the inconveniences that we will endure are not for ourselves, but for our neighbors. We are all in this together, and this is our opportunity to serve, to give, and to care for one another. So let's do this right. I believe we will in Anne Arundel County. We're a strong community. So I'm going to pass it on to Dr. Kalyanaraman, who will brief us on more detail.
Thank you. I'm Dr. Kalyanaraman, the health officer for Anne Arundel County, and as the county executive mentioned, the person who has COVID in the COVID virus in the county is a part-time resident of the county, also of Montana. It's a person in their 70s, and it was contracted out of state during travel in an area where there is known to be COVID transmission at this time. We try our best to limit the amount of information we provide so that we can maintain privacy for that individual while also sharing enough so that you know as the public what is happening. Right now we're coordinating our care, and we've been doing that for months now with the hospitals, local providers, and with the Maryland Department of Health, not only to provide care but to monitor potential cases, and as we have in this instance, to work with this person and their family to understand where they have been, who they may have been in contact with, and to look at how we can identify anybody else who may have been exposed to this person. We understand that this situation creates anxiety. We've been talking about COVID for months now, and it's here in our community. I want you to remember that there are steps that you can take to help reduce the spread of this, and we've been talking about these steps. Making sure that you're washing your hands, making sure that you're using hand sanitizer, covering your coughs and colds, and most importantly, staying home if you're sick. I know we talk about these often and they sound simple, but if each of us take these measures, we can have a tremendous impact in decreasing the spread of this virus. Particularly if you're feeling sick with symptoms like cough, runny nose, fevers, or shortness of breath, that's the indication that you should stay home from school or work, stay away from events in public as much as you possibly can, and contact your healthcare provider or the health department so that we can help guide you in your care and help figure out what needs to happen next for you. A lot of times we try to push through, and that's exactly the kind of thing that promotes the spread of the virus. We don't want to see it spread in our community. And as the county executive noted, we are here to take care of each other, and those are steps we can do to take care of each other. We're also recommending that those people who are at high risk, so the elderly, particularly those over the age of 60, people with chronic illnesses, and those who are homeless, stay away from public events, try to minimize their exposure to others, and this includes people who are healthy, who are healthy in these high-risk groups. those are the folks who are at the highest risk of suffering complications from COVID and also potentially dying from it. And so limiting your contact with others will help decrease that spread and also decrease your risk. We've been working with our partners both in city and county government and also our community partners to prepare for this. We've been contacting hospitals, our federal partners, the state health department, colleges, faith-based organizations, and have been working on how do we make sure that we get this message out. If there are people who are concerned, how do we talk to them and guide them through this? And then if there are people who are suspected of having this, how do we work with them to provide care for them? And so at this point, I'm going to turn it over to Tim Michaels, the head of OEM, to talk a little bit more about our response.
Thank you, Dr. Kalyanaraman. I think it's important to note that we started our planning efforts well in advance of January, so I feel that we are well prepared for what we're experiencing at this particular time. We're working very closely with all of our local and regional partners. We're in close contact with the state to make sure that we have the most timely information and we disseminate that information out to all of our stakeholders in county government. And that all culminated today in an exercise that we held where all of the heads of government came together working cooperatively to ensure that we've effectively planned for events such as this. I think that we are well prepared. We have put in place systems to make sure that we're able to request resources that we may need or identified gaps as this progresses. And I'm just very proud of the coordinated effort of all of the county agencies and our state and local partners, including the city of Annapolis, so that we can coordinate this response to the best resolution for the citizens of the county and the city. Thank you.
Good afternoon. I'm Pam Jordan, and I'm the director of the Anne Arundel County Department of Aging and Disabilities. The Anne Arundel County Department of Aging and Disabilities has been working very closely with the county administration and all of our county partners over the last several weeks to develop a measured approach that will keep staff, volunteers, and residents safe and informed during this very fluid situation. Consistent with what the health officer's comments reflected, older adults over the age of 60 and those with pre-existing medical conditions have a greater risk of serious illness. The Department of Aging and Disabilities shares the public's concern about this issue and will continue to align our policies and procedures with the recommended preventative measures. The health and safety of our older adults is our top priority. This morning, we took the following steps. All special events and holiday celebrations, flea markets, conferences, and non-essential gatherings for the department and within our senior centers have been postponed or canceled at this point. The second step we took is that all trips out of the senior centers, except for our local trips for essential items like food, prescriptions, and supplies, have been also postponed or canceled. Staff and volunteers will continue to implement everyday preventative measures outlined by the Anne Arundel County Department of Health to slow the spread of COVID-19. We encourage senior activity center members, older adults, individuals with disabilities, and professional and family caregivers to do the same. We will continue to monitor closely and take the health of our older adults very seriously. Let's take care of our older adults and each other through this time. Thank you.
Good afternoon. I'm George Arlotta, the Superintendent of Anne Arundel County Public Schools. Let me take a quick minute to thank our partners. Mr. Pittman and county government have done a fantastic job of staying in touch with us and my team with them over the last several weeks. Certainly Mayor Buckley and the city of Annapolis the same. And without question, Dr. Kalyanaraman, our chief medical officer here in the county, has been nothing but superb. We talk several times a day. He's been giving us great advice, and I think we're very lucky as a county and as a community to have him leading the way for us. We will continue to follow the direction of the health officials here at the county level, the state level, and our contacts with the CDC and the federal government in terms of proper hygiene, cleaning of our buildings, encouraging our students and staff to wash their hands carefully and thoroughly several times a day. We have gone through our own cleaning protocols, which continue throughout the day, and with each of our night crews in each of our schools to maintain that hygiene in each of our schools. Based on today's exercise and conversations with the Department of Health, we are going to continue to maintain schools. Schools will remain open until we are advised otherwise. Keeping that in mind and keeping schools open, we are going to carefully consider all those non-essential events and whether we will continue to move forward those or not. We're going to go back tonight and review each of those and then make decisions tonight and tomorrow into the future about those large-scale events and if we want to continue with them. We have already canceled all out-of-state and out-of-county travel, and we will, out-of-state and international travel for our students and staff, and that includes professional development for our staff. And we'll be considering, based on advice of the health department, on a case-by-case basis, travel within the state for professional development and school field trips. So again, we hope to maintain keeping schools open, focusing on the health and safety of our students and staff, and we are going to be taking a careful look at those non-essential large public events and how we'll move forward those in the future. Thank you.
Are there any questions from the media?
Yeah, Doctor, could you talk to us, explain to us and evaluate the impact of this infected person on other county residents?
So that's what we're at the current time looking into is who has this person been in contact with. One thing that I can share with you is that this person has had very limited contact with the public, but we're looking in greater depth today to figure that out.
Can you tell us the current situation? They're in the hospital, secluded ICU, or, I know you can't get, but can you tell us what the current situation is?
Sure, the person is hospitalized at this moment in an isolation setting, but I don't have any more detail about the person's condition at this time.
Do you know how much time this infected person, do you know, like, their entry date into the county and the state, into the time they found out when they did, in fact, have the virus?
I can share that the person has been in the state for approximately a week or so. It's hard for me to pinpoint the date of onset of symptoms at this time, but we know that they've been here for about a week.
Can I just follow up on that? I just wanted, you said that this person contracted it during out-of-state travel to a place where it is COVID-19 is known to have been transmitted. I just wanted to make sure that's
Yes.
what you said. Okay, and because I know one of the issues with this illness in general is the late onset for symptoms to show, can you give us any sort of timeline between when you had first contact with this person and when you began monitoring and when the test results came in? It'll be helpful to everyone in terms of wrapping our heads around how this is presenting itself.
Sure. So this person encountered the healthcare system approximately 5 days ago, and since then has been essentially self-isolating and being monitored to make sure that symptoms weren't getting worse. They were able to get the resources they needed.
And then when was and I know this is how it goes, that you monitor them, you check in and maybe test for other things like regular flu. When was the decision made, we need to get the coronavirus test? And then I assume you had the results in less than 24 hours. Was that decision made today, last night, or?
The test came back positive today. That test was actually done a few days ago. Ideally, the test turnaround time is 24 hours, but we're finding that with the large influx of testing, it's taking actually much longer than that, up to 48 or even 72 hours.
Be the first person.
No.
To say that. And I had a question for the county executive and the superintendent. The governor about half an hour ago everyone to consider canceling large gatherings, and you mentioned that, but also to have a plan for schools to be closed for an extended period of time. Can you explain how those talks are going and how that planning is going? Even though you're keeping them open now.
Have me do that? Thanks. So it is, it's an ongoing conversation for us. So we are hoping that our plan is to maintain instruction, teaching, and learning with schools open. We might get to a point where individual schools or the entire system or possibly the state, depending on decision of the governor, would close. At that point, we have begun our planning about the continuity of several aspects. One is the continuity of the school system. So payroll, accounts payable, our technology, all those things have to keep up and running from a distance if we're closed. So we've got, we have that plan in place so that we can have a continuity of the school system ongoing in terms of administration and operation. 2 is instruction. That's the second key piece, and how we can maintain in some form or fashion instruction between our teachers and our students at all levels. So we have plans in place we've been working on for several weeks that will include Google Classroom and online instruction, will include lessons on TV for those students that don't have access to the internet. And so we're working on those plans now. We've got about 2 weeks worth of lessons already prepared, and then we will continue that process depending how long we're closed, whether it's closed for a day or two to clean a building or over multiple days or weeks. And so that's going to be an ongoing process about how we can best deliver instruction, engage our teachers with our students. The third point is meals. One of the things that we're very concerned about those students that get their primary meals with us, both breakfast and lunch, and in some cases dinner in a number of our buildings. And so we are working on a plan to deliver meals. We do that now over the course of the summer. We have sort of a Meals on Wheels program. We have certain sites around the county where we're delivering, our food service staff is preparing meals and delivering breakfast and lunch to students around the county that are in need. Our plan is to beef that up as best we can. Certainly some of that's going to depend on healthy staff that can do that delivery, and also the supply chain of us being able to get those foodstuffs in, getting meals prepared and getting them out to schools. But those are 3 areas in terms of preparation. And if the schools are closed, the continuity of the administration of the school system, the continuity of instruction, and continuity of delivering meals to students in need.
And County Executive, can you be more specific about the event you canceled for tonight? And what can residents expect? I mean, should you expect any concert, fair, any non-essential? What exactly should people expect to be canceled?
Yeah, I mean, I gave you the guidance on the public events, the private events that are not part of government.
Right next.
And there are, I think we have permits for 57 events that are registered with inspections and permits between now and November. And it may change, but now those decisions are going to be made by local organizers for now. As far as county-sponsored events, if you follow Anne Arundel County, you know we have a lot of town halls and a lot of community engagement and things and commissions and boards where people are coming in and gathering. And those decisions you're going to be hearing about over the coming days. We're in the process of doing our general development plan for plan and zoning, and it's very heavy on community engagement. And so the question we're asking right now is, do we need to postpone that? Is that not going to be possible? But there are going to be cancellations.
Okay. But it's too early. Is it a case by case? You'll have to figure out what.
It's case by case, and we may be making announcements by category too, by department.
Okay. Thank you so much.
Yeah.
What about high school sports? Any plans on changing championships or?
So we're looking at it on those pieces that are essential to our instructional program. I'm of the belief that sports are an essential part of our instructional program. So our plan is to continue with sports. Spring season, as you well know, is getting ready to start, getting under practices and tryouts are over, and spring sports are getting ready to start. So we're hoping to continue sports. One of the things that we're going to have to consider is whether we'll allow spectators at those sports. You've seen that going on at the pro level and at the college level, and even there's some college. I know that the NESCAC, the New England College Association, has now canceled sports for the spring. We're hoping not to go that direction. We'll certainly always take our direction from the experts in the Department of Health. But that is one of the considerations that we are undertaking now, is allowing our athletics to continue the contests for the students, and whether we will allow only essential personnel and or parents or spectators is to be determined in the future.
Doctor, you said the patient was not in ICU, but is in a room. Could you maybe characterize the condition of this other woman?
I actually don't know the type. I can't tell you if they're in the ICU or not at this time. I mentioned that they were in isolation, meaning that there was limited entry
Yeah,
to the
in
room.
isolation, yeah. Do you understand of the condition they're in, or have an idea?
The best that I can say that they're in fair condition. I know that doesn't share a lot of information, but I haven't had an update since this morning.
Are they in Anne Arundel County? I know there are some jurisdictions that don't have the isolation capabilities that, say, Hopkins Hospital might have.
So yes, we do have that capability, and each of the hospitals has the capability to do isolation either for a short period of time in concert with another hospital where they can transfer, or to be able to manage the entire duration of care. So those plans have already been made or in place.
What's the total count between both hospitals, Anne Arundel Medical Center and Baltimore Washington Medical Center, of isolated patients they can handle? Well, how many isolated patients can the whole county handle?
The isolation is actually more of a condition of how you set up that room. And so isolation can happen in a variety of methods. So it's hard to give you an exact number of that. In terms of our preparation, we've prepared with the hospitals around how many patients with COVID they can handle, and that has to do with enhanced protections around limiting contact between that patient and other patients.
Doctor, given that this patient you were able to find out that they had the virus based on contact tracing. Can you talk a little bit more about contact tracing and what you're doing now to, limit the spread?
Right. So our contact tracing, both in this case and in general, is to have a detailed discussion with the person about who they have been in contact with, when they were in contact with them, and where they were in contact with that person, and then to identify those people who they had the greatest exposure to and also the riskiest exposure to, talk to those people, and then move out in essentially concentric circles. And so right now that's largely looking at family, looking at interactions with the healthcare system. And as I mentioned earlier, there was virtually very limited contact with the public for this individual, which actually helps in this situation.
Doctor, how many additional people are you now monitoring in looking at this chain of contact?
We generally don't share that information. Once again, that balance between individual privacy and the public's need to understand the health condition. We are routinely monitoring folks who are suspected of having it, and also people who have had travel to other places where there's high case rates. But we don't publish those numbers or locations for the privacy reasons.
Thank you, everybody. Thank you.
Thank you.
I think
Did you want to say